In Guinea, a discovery in yet another tragic side of the Ebola outbreak. The bodies of 8 journalists and health workers killed by frightened people they were trying to help, making it plain why today the UN's top council called the health crisis a security crisis too. Senior correspondent Adrian Arsenault explains.
It doesn't have to be like this, but in West Africa, Ebola is winning. The rate of infection doubling every 2 to 3 weeks. If that fact and these pictures aren't alarming enough, then the UN has a message to consider. Holding a Security Council session on Ebola today, talking of a health crisis for just the second time in its history. Only AIDS has ever garnered this much worry at this level.
This is likely the greatest peacetime challenge that the United Nations and its agencies have ever faced. None of us experience in containing outbreaks has ever seen in our lifetimes an emergency on this scale.
The level of response needs to be about 20 times greater than it is at the moment.
In financial terms, $1 billion at least is what all suggest is needed. Barely 15% of that has materialized. People and equipment are an issue too, and now the UN plans to have a mission on the ground by the end of the year. But time isn't kind when it comes to Ebola, so countries like Sierra Leone are taking drastic measures now. Its 6 million citizens scrambled today to get last-minute supplies before a 3-day government-ordered lockdown that has just begun. People told to stay close to home so volunteers can check every house, find those with Ebola, count them, help them, or try to. Authorities are convinced this might also slow the pace of transmission.
If the result shows that the spread is minimized, we may be tempted to increase the days to some other days.
The intentions are good, but there's nervousness. Volunteers will mark doors of the homes of the sick, sparking fears of families hiding loved ones or being shunned by neighbors.
And now we've seen this really cataclysmic outbreak.
Médecins Sans Frontières, which has been leading the way in caring for Ebola patients, worries that people's burdens will only grow.
If they can't go to work, if they can't go to markets to buy food, if they can't even get to a medical clinic for something as simple as giving birth or for malaria, all of these things serve to make very great hardship and serve to make hysteria.
Then the reality. Beds in Sierra Leone are already full. The feverish and frightened already being turned away from clinics. And bodies are already being picked up in the street. So how is anyone else who gets sick going to get help in time? Adrian Arsenault, CBC News, Toronto.